Welcome to the WisDems Roundtable. This month, for Women's History Month, we will be focusing on women's healthcare. My name is Katrina Nichole. I'm a Wisconsin native, an advocate for women's rights, and I believe that our healthcare system should be equitable and accessible for all people, especially for women and our access to healthcare as it relates to reproductive rights. We know one of the issues that unites us as women in Wisconsin is our fight to gain comprehensive and complete healthcare. Right now, Wisconsin has an abortion ban from 1849 in effect and is facing an OBGYN healthcare crisis. We've convened tonight's panel because Wisconsin deserves to know that there are women in places of leadership working to gain those rights back. It's so exciting to have Lieutenant Governor Sara Rodriguez, Senator Minority Leader Melissa Agard, and sexual health advocate Gabby Aranda-Pino here tonight to discuss these important topics. We're going to talk about these issues facing Wisconsin women and how we can move forward to fix them, like voting on April 4th for Janet Protasewicz, who is running to fill a seat on our state Supreme Court, and Jody Habasinski, who is running for State Senate District 8, whose win will help prevent a GOP supermajority. They're great reproductive healthcare champions that we need in Wisconsin. To help them get elected, please sign up to volunteer for opportunities at wisdems.org/volunteer. All right, let's begin with introductions. Lieutenant Governor Rodriguez, can you please start us off by introducing yourself and give us your background on how you're connected to the fight for reproductive rights?
Absolutely. So I am Lieutenant Governor Sara Rodriguez. My pronouns are she, her, and I have been working in reproductive health care for most of my career. I have been a public health nurse, whether that has been working internationally or locally on reproductive health care, and I chose to run for office. So I originally chose to run for office in the Assembly in Wisconsin because I really wanted to have a healthcare voice within the Assembly. And then after that, I ran and won to be Wisconsin's Lieutenant Governor. And so here's a place where I can take that microphone of the Lieutenant Governor's office and really talk about the important things for women in Wisconsin, including reproductive rights.
Thank you, Lieutenant Governor. Senator Agard, welcome. Could you please introduce yourself and give us your background as well on how you're connected to the fight for reproductive rights?
Absolutely. It's exciting to be here and so important that we make space to talk about abortion care, healthcare, and frankly, women's rights in general. It is Women's History Month after all, and we have a super important election coming up that will help equalize things for Wisconsin if people turn out and vote. I am proud to represent the 16th Senate District here in the state of Wisconsin, which is parts of Dane County, and also to be the minority leader in the Senate, bringing my caucus together to lift up the priorities of people all across the state of Wisconsin. Planned Parenthood was one of my very first healthcare opportunities. As a young woman, my family did not have many resources, and that was a place that I could go where I knew that I would have people who would tell me the truth about my body and help empower me to be able to make the best decisions for myself, my health and well-being, and to own my own sexuality as a woman. It's something we don't really talk about a lot. I first ran for the legislature about a decade ago when my kids came home and said, "Hey, Mom, we're being taught in school that the will of the people should be the law of the land. Why are all those people marching around the Capitol building? And why is the legislature and the governor not willing to hear them? What's wrong?" And one of the things that I was taught as a young woman, a little girl, by my father was, if something is wrong in the community, stand up and try to be the solution. You might not be successful right away, but you will learn something about yourself, your community will learn something about you, and you might be able to make good change. So on behalf of my kids and all the kids in the state of Wisconsin, I decided it was time to run for office. And I've been in the Capitol building for about a decade. And it is vitally important for me lifting up the frame of the people of the state of Wisconsin, being a moral guide and being someone who listens to what it is that folks want. Certainly, women's health is one of those things that people want in the state of Wisconsin.
Thank you, Senator. Tonight, we also have Gabby Aranda-Pino with us. Could you please introduce yourself and give us your background on how you're connected to the fight for reproductive rights as well?
Yeah, of course. Hi, everyone. Thank you so much for having me. So I started being super interested in reproductive health and reproductive justice in college. Actually, I got exposed to gender women's studies classes and decided to major in it. Had originally wanted to be an OBGYN, but decided to get my master's in public health instead with a focus on women's health. So I got appointed to the Wisconsin Women's Council, and I also run Dane County Public Health's sexual reproductive health program, but I'm here as an individual, not representing either of those. But at the core of everything that I've done, I've had reproductive rights and reproductive justice in mind. And I think it's so important that, especially in this very difficult time, that we are raising our voices and talking about these issues and raising awareness. In undergrad, I started a nonprofit dedicated to raising awareness about women's health and the issues and barriers that so many Black and Brown women specifically face when trying to get gynecological care. And it's not accessible to a lot of people, but it's even more difficult to access that when you take into consideration intersectional identities and location, so rural Wisconsin and the OBGYN shortage. So all that to say is that this has been at the core of everything that I've done, and I'm super excited to be able to share this space with everyone here and talk about it.
That is amazing. You all have such incredible backgrounds, and it's clear that having you all here in this discussion is going to be really valuable and very important for all of us in tonight's discussion. So this is really meant to be a discussion, a roundtable, that sort of thing, where we're able to kind of bounce back and forth between our thoughts on the different questions that we're going to ask tonight. Our first question of the night is for Lieutenant Governor Rodriguez. Your work leading up to your current position as Lieutenant Governor centered around a passion for public health and community. You ran for office because you did not want leaders putting politics before people's lives and livelihoods. What have you learned in your time as Lieutenant Governor about how the lives and livelihoods of women are impacted in Wisconsin by our state?
For that question, you're right. I ran for the assembly because I was so frustrated that our Republican-led legislature did not meet for 8 months during the COVID pandemic. And as a nurse, as a public health nurse, I believe that I could provide a really important clinical perspective to the assembly. But I'd like to talk a little bit about the tenor of the conversation around reproductive rights here in Wisconsin and how difficult that has been, even when I've been in the assembly. So I was on the health committee in the assembly, so I got to see their agenda up close and what they were really looking to do. And we had them testifying on all of these abortion bills, and they were all men who testified on these anti-abortion bills within the health committee. And I'm a nurse, I'm a clinician, I'm a data-based person. So I asked very clinical questions about the safety and the effectiveness of what the type of legislation that they were proposing, which I found to be clinically unsound and frankly dangerous. And the chair of the committee not only gavelled me to get me to stop asking questions, but he called me a nasty woman during a health committee meeting. And that's the type of tenor we're working with here in Wisconsin on the Republican side of the aisle. So now, and this was pre-Dobbs decision. This was even before that happened. And so now we're having to work with the Republicans to be able to restore rights that we have had previously before the Dobbs decision came down here in Wisconsin. And what I've learned as Lieutenant Governor now is I get the privilege to go all across the state. And as a clinician, as a nurse, people come and talk to me and they tell me their stories. And they are heartbreaking stories of wanted pregnancies that were no longer viable and people could not get the care that they needed. And as a clinician, I know this is dangerous. This is dangerous for the women of Wisconsin. And so I am grateful that they felt that they could share those stories with me, but I wish we didn't have to share such heartbreaking stories to really validate the humanity of women and validate that we have the right to make these decisions about our bodies.
Yeah, that's incredibly disappointing that we have that kind of legislature that's happening right now within Wisconsin, because we know that there are so many reasons why women need better access to healthcare. And I really appreciate you sharing that information with us. So our next question is again for Lieutenant Governor Rodriguez and for Gabby Aranda-Pino. You both have a background in healthcare, and we would love it if you could speak to the impact that last year's Dobbs decision has had on the medical community in Wisconsin. And have you heard concerns from our medical community in Wisconsin, and what sorts of on-the-ground issues are you seeing or hearing as well?
So as a public health professional, I definitely have heard from clinicians on the ground and OBGYNs and physicians about how difficult the Dobbs decision has made their jobs, especially because if you look at the state statute and us reverting back to that archaic abortion law, it's really confusing. It's really hard to understand what you can and can't do. And as a physician, that's really scary, because what if you do make a call that you think is in the best interest of the patient and that you think is medically necessary, and it comes back to bite you and you get criminalized or you get punished for that? Looking at the statutes, there's so many different lines that are saying the same thing, and they're different classes of felonies. And I think it was purposely made that way because if it is vague, it's a lot easier to criminalize the providers that are doing these services. What I've heard from OBGYNs also is just how ridiculous it is that they need to consult with 2 other physicians to make sure that this medically necessary procedure is okay. And that's not accessible in an emergency. You can't just tell someone, oh, I'm sorry, stop tying. I have to go talk to 2 colleagues to make sure it's okay that I help you, because otherwise it's going to fall on me. And I think it's so frustrating that we're limiting access even more. It wasn't great before the Dobbs decision, definitely by any means. There was a lot of work to do there. The 24-hour mandated waiting period and the fact that you had to see the same provider for 2 or 3 appointments to do medication abortions was also very inaccessible. And one of the doctors that really inspired me to pursue this type of work, Dr. Lobby, used to do volunteer to do abortions at Planned Parenthood on the East Side, and had let me know all of these very difficult routes and hoops he had to jump through as a part-time abortion provider in his free time to do abortions, and how difficult it was, because if he started a medication abortion with a client, and with him being part-time, he had to make sure that he worked his schedule around to make sure that that person could get the abortion and finish that procedure, which is even harder for people if they're sick or if something comes up and they can't go to the clinic to do that. And so, I mean, that's not even on the table anymore, that we can't do that. And luckily, people specifically aren't getting criminalized for leaving the state to go get an abortion, but that's not accessible to so many people, especially if they're not near the border of Illinois or Minnesota, or they're living in rural Wisconsin where there is an OBGYN shortage throughout the whole state. It's just so difficult, especially marginalized people or low income people. It takes time and resources and support to be able to leave the state to get an abortion, and that's just not the reality for a lot of people. That's not accessible to a lot of them.
Yeah, I absolutely agree with Gabby. I was at a meeting the other day where there were a couple of medical students who were specializing in obstetrics and gynecology. And I asked them, has this law changed your mind about where you are going to practice? And both of them said yes. Both of them said that they wanted to be able to fully practice at the top of their license. They wanted to not have the care that they were performing criminalized, and it had changed their mind in where they are going to practice moving forward. And that's really scary. Even pre-Dobbs decision, Gabby was saying, we've had a shortage of OBGYNs, particularly in rural areas. This is only going to get worse if we criminalize clinicians' behavior. And that is what I'm hearing all across the state of Wisconsin, and that they've had to set up clinics and refer out of state for folks to be able to get the type of care that they need. And it is not easy for individuals to be able to access that. It wasn't easy before, as Gabby said, it's not easy now. And people are afraid to be able to do what they need to do, sometimes to save someone's life. Because of fear of losing their livelihood, their license. So it's a real issue here in Wisconsin. It's a real issue in other states, and it's just going to get worse.
Mm-hmm.
Yeah, it's incredibly disheartening to hear that it's just becoming more and more challenging for so many people to be able to access the kinds of healthcare that they need, whether it is for choosing for an abortion or for a medically necessary procedure. I think about my own personal story of having a corneal ectopic pregnancy and thinking about having to go through that now and what our current laws are. I would be dead. Like, I literally would not be alive. And I think that is something that we really need to think about more when we're making laws and when we're making new legislation, because it's very emotional for women in particular to even ask for help and to advocate for ourselves, and to continually have to jump through more and more hoops, and now having to have medical professionals do the same. That is just so challenging. So thank you both for sharing. Our next question, Senator Melissa Agard, what sort of work is being done in the Wisconsin legislature to address some of the issues that we have just heard our other two colleagues talk about, and what are you hearing from your constituents?
Yeah, so, I think right now what's being done in the legislature is not what we want because of the extreme gerrymandering in the state of Wisconsin, and the fact that the Republicans hold almost 2/3 of the seats in the legislature, despite the fact that our state is very purple. It's 50-50, maybe leaning a tiny bit more blue, in fact, knowing that the legislature does not represent the will of the people is super challenging. It is hard to go into that building day after day and know that you are fighting for and advocating for what the majority of the people want in our state. And it continues to not move forward because there's a few men with an extreme amount of power who have rigged the system to follow their ideological lines, to the point that they introduced a bill recently that would create exemptions for rape and incest, in that women can only make good decisions if they are a victim of rape or incest. That in everyday situations, we can't make healthy decisions for ourselves, but in that situation, they will trust us to do. That's disgusting. It's disgusting that we have less rights now than we did a year ago. And frankly, the fact that we have a law on our books from before women could vote, when people were owned for their labor based on the color of their skin, and the white men who were the policymakers of our state rode horses in order to make the laws, right? Our world has changed. And it is past time that our legislative makeup changes. So it does bring me great hope that we have this upcoming election for the Supreme Court, where people will have the opportunity to vote for Judge Janet. And the fact that we have a special election in Senate District 8 for the amazing Jody Habush-Sinkin. She knows firsthand that it is the job of government to provide safety and opportunity for everyone in the state, not just for the wealthy and well-connected of the majority party. So in order for me to be able to go to work and come home a little less bruised and battered on a daily basis, I ask that people understand that democracy is not something that we watch happen. It is something that we participate in and make happen. And we know in Wisconsin, and this isn't unique in Wisconsin, it's in fact across our nation, that spring elections typically have a much lower voter turnout than in fall elections. And we have an opportunity to break that paradigm. We have an opportunity to break the paradigm that the Republican Party has created in Wisconsin, that it's their way or the highway. But that is going to take people standing up, taking space, and getting out to vote, and getting all their friends and family to vote. Because when we know that when people in Wisconsin vote, that democracy is upheld, and that women and families, and frankly, all of our communities do better. There are so many young people in Wisconsin that are making choices to leave Wisconsin. It's not just young doctors who are thinking about where it is that they want to practice, but it's our kids who are thinking about where it is that they want to put their roots down. And we should not be proud of the fact that one of our greatest exports in the state of Wisconsin is our kids, kids who we have invested an awful lot in. And my own son left the state because our home does not match his values and what it is that he wants to live with. So when we hear the Republicans saying that moral issues are not the issues of government, I call them on that. That is how it is that people decide where it is that they want to live. That's why Dane County continues to grow, and other parts of the state are suffering. We need to make it so that no matter where it is that you live, no matter what gender you are, and no matter what sexual orientation you identify with, that you're able to have access to the healthcare that you need in order to be a healthy person. And that's what I go to work for every day. That's what Democrats in the legislature go to work for every day. And we know that, the mountain is high in front of us, but it is every single step that we take, small steps that we take that make the difference. And not getting overwhelmed by the big picture, but thinking about every day what thoughtful actions we can take and who it is that we can bring along with us on this journey to ensure that Wisconsin is a place of opportunity for everyone, and that women are not in a way back time machine.
Our final question tonight is for the collective group, and it is, what do you see as the path forward for Wisconsin to create a better future for the citizens of our state?
Vote, vote, vote. I can't say it any more than that. Like, we have to get involved. We have to know. We have to vote. And it is so important to make sure that you don't assume that the people that you know are voting. You have to bring them along with you and let them know what is on the line. So this is our path forward. We have this, election coming up this spring. We have got to vote and move forward Wisconsin so we can get these rights back that have been stripped from us.
I agree with everything Lieutenant Governor Sara Rodriguez said. I think our voice is our greatest power and our actions are the best way that we can mobilize. I hear a lot, especially with my generation, of like, well, why should I vote? I'm just one vote. It's not really going to make a difference. But then if you think about everyone having that mentality, we're not going to make any change that way. So I've always reminded people, like, yes, year one vote, but that multiplied by however many other people are thinking that, it's a lot of people, and that's how we make change. And aside from the physical act of voting, it's using your voice to raise awareness, because there are people that are not going to be fully informed or staying up to date with what's happening in the state. I think a lot of times we take things in our positions of like being very involved in government and public health, of taking it for granted that we are very informed and we are well up to date with what is going on, but that's not true for everyone, especially people who have low literacy or low health literacy and don't truly understand. I mean, government is really tricky to navigate and understand. And unless you have that background, it's a lot more work to be able to understand it. So using your voice to empower others to make those decisions, but making it in a way that they're going to understand and resonate with it and want to take action.
Absolutely. Voting, raising up your voice, encouraging people in your community. Those are all vitally important things. It's hard being the closer in a conversation like this, but I have a few things that I can add. Right now in Wisconsin, people have the opportunity to early vote. That has started. So make your voting plan now. Don't just assume that you're going to vote on election day, because life gets complicated, right? You might be asked to come in and pick up a double shift. Your kid might get sick. Your dog might run away. You might get a cold. You might get some bad news and feel like you don't want to leave the house. There are a lot of things that can happen. Life is messy and life is complicated. And that's why it is important that we have early voting and absentee voting opportunities for people in the state of Wisconsin. Make sure that your IDs are up to date, and that you go to myvote.wi.gov and check that your ID is up to date. Find out where your polling place is and research the people that are on the ballot. vote up and down. Don't just vote for the Supreme Court. Don't just vote for the person who you know. Look at all of the elections that are on your ballot and do your research before you show up to the polling place, because really local elections matter as well as top of the ticket elections. Additionally, we all have a couple extra hours in our days. Go and volunteer for a candidate who is on the ballot that you believe in, or a cause that is on the ballot that you believe in. Offer to go knock on doors or write postcards, make some phone calls, some text to people in your network, encourage them to get out and vote, because this election is going to be it's going to be pretty close. After all, this is Wisconsin. We are a very purple state, and it's going to depend on all of us seeing one another and realizing that taking the time to vote and taking the time to knock on a few doors and reach out to our friends, that will make a difference. And we will have good reason to celebrate on April 5th.